Today, the Cabinet COVID Committee met to discuss a potential move into Step 3 of our Path Forward plan. Now, since it was released in January, the Path Forward has been clear and it has been transparent. The details are posted on our website. Step 3 would see restrictions relaxed on places of worship and adult and youth team sports. It would reopen museums, movie theaters, and art galleries, along with zoos, casinos, and bingo halls. And finally, it would allow private indoor social gatherings with restrictions. And this is a significant step that would touch every part of our province. It would also create new opportunities for the virus to spread in our communities. And that is why, when we announced the plan in January, we were clear. Moving to Step 3 can be considered only when hospitalizations for COVID patients are under 300 and declining. Hospitalizations must be on a clear downward trajectory if we are to enter any new step, just like they were when we entered Steps 1 and Step 2 earlier this year. Today, while hospitalizations are indeed below 300, they've risen in recent days. The decline that we saw in January and early February has stopped. Alberta now sits at 280 COVID hospitalizations, which is a rise of 16 from a week ago. And this is a problem and a warning sign that we must take seriously. In fact, based on transmission rates in the province, we expect to have 300 people in hospital, most likely within a week. And that's why we decided not to move to Step 3 of our Path Forward plan today. There will be no easing of any restrictions at this time. This is the safe move, it's the smart move to make for our province right now, and it's absolutely necessary to help us avoid a third wave that would take more lives and once again put more pressure on the hospital system. This pause is prudent and it's essential, but I know that for many people it's a disappointment. The weather is warming up and we're all tired of the pandemic and the restrictions on our businesses and the restrictions on our activities. Most of all, I know that Albertans are tired of having to worry about this virus and the risk to their families and to their loved ones and wondering when life will get back to normal. But the reality is that given recent case numbers and the number of people in hospital due to COVID is likely to go back over the 300 threshold in the next week. So it would be irresponsible and unfair to Albertans to ease measures now only to reinstate them a few days later. The path forward is about taking our time to make good decisions based on the evidence. And until today, we had seen 7 straight days of growth in the number of people in hospitals. And that hasn't happened since we had 40 days of increases that began October 30th. That was the start of the second wave. Vaccinations are the path out of the pandemic, but the fact is, they didn't start coming fast enough or in large enough amounts. Currently, almost half of those who are hospitalized and almost 90% of those who are in an ICU are 65 and under. So I'll say that again. Half of those who are in a hospital bed for COVID are under the age of 65, and almost 90% of those in an ICU for COVID are under 65. Most of them wouldn't be there if they had been vaccinated at this time. We've also seen increases in both our active as well as in our new daily cases. The positivity rate is also increasing in all 5 of our zones, which is another concerning sign. Our cases are rising and the spread is increasing. Last week, the reproductive rate, or the R value, for our province was 1.14. Anything above 1 means that cases are growing. And in Calgary, the R value was 1.23, while Edmonton's R value was 1.13, and the rest of Alberta averaged at 1.05. But perhaps the biggest issue is that the number of variants of concern is also rising as well in the province. Now, these variants, they now account for 16% of our active cases, and that's up from 10% just a couple of weeks ago. And this is not the direction that we want to be heading in as a province. We saw in November, as well as in December, what can happen if things get out of control and just how quickly that can happen. Obviously, we now have vaccines in our corner and Alberta's rollout is picking up speed. This week, Alberta will begin the final stages of Phase 2A of our vaccination program, which is offering it to everybody who is aged 65 and older. And this is remarkable progress based on our supply, and it puts us well ahead of most other provinces. And we expect to announce the start of Phase 2B, giving it to everyone with serious underlying health conditions very soon. Brighter days are coming, and they're coming soon. We just need to hold fast for a little while longer. We need to stay the course and to keep abiding by the public health measures that can slow the spread of COVID-19 in our province. So please pay close attention to updates on our vaccination rollout. And when it's your turn, please sign up for your shot, show up for your appointment, and follow up with your second dose. The more people who do this, the faster we can all get back to normal with our daily routines.
Over the last 24 hours, we have identified 456 new cases of COVID-19 and completed about 7,500 tests. This puts our positivity rate at about 6.1%. We have identified 110 new cases of the variants of concern, which represent about 16% of all of our active cases. There are currently active alerts or outbreaks in 339 schools, or about 14% of all the schools in the province. Currently, these schools have a combined total of 1,474 cases since January 11th. As the Minister mentioned, there are currently 280 people in hospital for treatment for COVID-19, including 48 in the ICU. Sadly, I must announce that 5 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with anyone mourning the loss of someone they loved from COVID-19 or from any other cause. This has been a long pandemic, and I know that many people will have mixed reactions to the decision to delay Step 3. I have put a great deal of thought into the message that I want to give Albertans today. It is important that every one of us understands the powers that our actions have, and how crucial it is that we all make choices that protect our communities over the coming weeks. I said on Thursday that it might be possible to consider appealing to Albertans who are currently not following public health measures by offering them a lower risk way of gathering. Unfortunately, as we have seen cases, variants, and hospitalizations continue to rise in recent days, we cannot take the risk of easing any measures at this point. Now is not the time to abandon tried and true practices that have protected our communities and our healthcare system over the past year. COVID-19 is still very much with us. For those who would say that even 300 cases in hospital is just a fraction of our acute care capacity, I would remind us all of our experience in November when cases and hospitalizations began to grow sharply. Every 2 weeks from mid-November to late December, the number of people needing hospital care for COVID-19 grew. It grew by 200 to 250 people every 2 weeks, going from 270 people in hospital on November 12th to 927 just 6 weeks later. The reality is that once we hit a growth phase of this virus, our numbers will not stand still. That's why we all need to continue doing our part to not only follow the letter of the law and the public health orders, but the spirit of them as well. While immunizations will eventually protect those who are most vulnerable, we are not yet at a point where we have protected this whole group. As the Minister mentioned, 88% of those in ICU right now because of COVID-19 are younger than 65 years of age. Our current immunization program has not yet moved to offer vaccine to those under 65 with high-risk conditions, and even after receiving vaccine, it takes about 2 weeks for the shot to provide protection. We are in a challenging but hopeful time. Spring is officially here. The snow is almost gone, and warmer weather opens up many opportunities to get out of our houses, to stay active, and safely gathering with friends and family. In a few months, with widespread immunization, we will be in a very different place and able to enjoy many of the elements of our lives that we have had to put on hold because of COVID-19. But until we get there, it is more important than ever that we keep cases low. The rules in place, whatever they may be, are only as good as the steps all of us take, day in and day out, to follow them. Looking for loopholes or thinking that it doesn't matter if you bend an inconvenient rule just a little bit jeopardizes the progress that we have all made together. Our vigilance in minimizing the number of people we come into contact with each day, physical distancing, wearing a mask, and staying home and getting tested if we feel even slightly unwell are all crucial to stopping the spread of the virus. Though it may be hard to see it, our choices have immense power, and each of us has a say in whether cases rise or fall in the days and weeks ahead. I urge all Albertans to make the best possible choices they can to prevent cases from rising and to keep each other safe from this virus.